Good morning, good afternoon, or good evening, depending upon when you're watching this. So we need to talk about carbohydrate and amyloid stains. This is a very, very long lecture, so of course, feel free to take a break whenever you need to. So what we're going to do is we are going to discuss the carbohydrate stains as well as the amyloid stains. We're going to go over steps, functions, and results and show you some pictures of what they should look like once completed, as well as give you some tricks of the trade along the way. So let's get started. So again, we're going to go over all the steps, functions, and results. We're going to do some interpretation of Carson for you. She's going to try to throw you for a loop in certain situations. And then, of course, tricks and tidbits that apply towards the appropriate staining. Another thing that we're going to start talking about is holding spots. So as you are running special stains, there are places where you can drop a slide and hold a slide in a particular solution. Most of the time that would be water. And by having holding spots, you can leave your slide in that solution and tend to other things while you're sort of holding there. In some instances, it also helps the stain, especially when we're talking about developing a stain, bringing that color up into a brighter color. And by holding in that particular spot, it actually brightens up your stain for you. Now, there's a number of reasons for holding spots. One, when you're running special stains in industry, you're not just running one stain at a time. You're running multiple stains at a time. So by knowing your holding spots, you can drop your slide halfway through one particular stain and then tend to another stain that maybe you have to go through 2 or 3 more solutions before you get to a holding spot. So it allows you latitude to sort of move in between all the special stains that you're running at one time. It is not uncommon in industry to be running 5 to 10 stains at one particular time. I think my largest number of running stains all at the same time was 32, running 32, and that's 32 different stains, not necessarily just 32 slides. So as time progresses and you're in special staining, you'll get to know how to start to manipulate those. You're going to be manipulating these special stains in the laboratory, the student laboratory, and so as you're learning in the student laboratory, it's important that you know these holding spots to give you latitude to finish up or continue on with a different stain. So we're going to start with the PAS one more time, because the PAS you really need to know like the back of your hand. So this is going to demonstrate polysaccharides, neutral mucose substances, basement membranes, and fungi. Depending upon, and when we're talking polysaccharides, we're talking about glycogen. And so, there's this variable of different things that the PAS is going to stain. And it really is dependent upon which PAS you're doing. So again, we have the PAS with a hematoxylin counterstain. We have the PAS-G, and the G stands for light green. And the light green is a background stain where it's just going to lay over everything that's unstained. And the PAS-G is also known as PAS-F. Some people will call it one or the other. The PAS, when we're talking PAS-G, they're referring to the PAS with a green background stain. And when we're talking PAS-F, They're just referring to that exact stain, but they're calling it the PAS reaction with a particular tag for the fungus, which the PAS is tagging fungus as well. So those are the exact same thing. Then we have the PAS with digestion. So your digestion is when you digest out the glycogen that is in the stain, so that the pathologist has a comparison study. One slide, one patient slide that's demonstrating the glycogen, and one patient slide that the glycogen has been digested out. So this is a comparison to see exactly how much glycogen is in that particular tissue. Then we have the PAS Alcyon blue. So they call it the PAS Alcyon blue, um, but it's really kind of the other way around. It's an ALK blue PAS when we're talking about the protocol. Excuse me, because you're going to run an Alcyon blue and then you're going to tag it with a PAS reaction. So for whatever reason, it seems to be predominant that people call it the PAS Alk blue, but really the first part of the stain is the Alcyon blue and the second part of the stain is the PAS. So we're going to start with just the PAS, okay? The PAS reaction on that slide only. So you're going to depair and hydrate to water. Then you're going to go into periodic acid. This is your oxidation step. This is creating that aldehyde. So also remember that in a pinch, it is not preferred, but in a pinch, you can use chromic acid as a replacement for the periodic acid. But there are consequences to that. And the consequences are that the chromic acid is a much stronger oxidizer. So, and it is also orange. So if you have to use a chromic acid, you need to decrease the time that you are in that solution, because you can actually, once you create that aldehyde, if you keep oxidizing, you'll actually break that aldehyde off the molecule and you'll have a negative result. The other problem is that chromic acid by nature is orange. So when you water wash afterwards, you have to water wash longer to get that orange coloration out of the tissue. Otherwise, it's going to interfere with the remainder of the stain. So once you've oxidized, preferably with a periodic acid, then you're going to water wash. And that water wash is going to remove all the excess periodic acid and stop that oxidation from continuing to happen. This is a great holding spot. So you can hold in this water and tend to other things. Then you're going to go into Schiff's reagent. This is your glycogen stain, your fungus stain, your polysaccharide stain, your basement membrane stain. Schiff's reagent is basic Fuchsin based. Now remember that Schiff's reagent is in the refrigerator. It's held in the refrigerator. And it's when you pull the Schiff's reagent out of the refrigerator, it's best to pull the amount that you need and put it in a little flask or a little Copeland jar, put it in your Copeland jar, and let it come to room temperature, and take the bottle that you pulled from the fridge and put it back in the fridge. Because if you leave that bottle sitting out, it's going to sort of ripen, and ripening isn't the right word. It's going to develop with the sunlight and the air. So once that bottle starts to develop, it's going to get weaker and weaker and weaker. So you want to take what you need and put it back in the fridge. That's a trick of the trade. Now, you're going to go into that Schiff's reagent, and then if The next step is sort of an optional step. I call it the lazy step, yeah, because what that metabiosulfite will do is it's going to remove any unreacted shifts. Yeah, so it's going to remove any non-specific staining. And I sort of call it the lazy step because it's my opinion that if you have worked your PAS up appropriately in the first place, you shouldn't have to use this. But it's also a safety net at the same time to assure that you don't have any non-specific staining. So if you're going to use that metabiosulfite, you're going to go straight from your shifts into the metabiosulfite. From that point, then you're going to go into a water wash. Now, this water wash is the developing step for the shifts. When your section comes out of shifts, it may or may not be pink for you. It may be a real light pink. It may not show any pink at all, or quote unquote rose. Yeah. So when you go into the water, it's going to bring up the brightness of that pink for you. Now, this is a great holding spot, because the longer you hold there, the brighter that pink is going to get. Now, there's sort of a trick of the trade here. And so whatever time it is that you went into your shifts region is the same amount of time that you should stay in that water wash. And the equal amount of times then assures you that you have brightened that shifts up to the amount of dye that you've given it. It's that got dye concept. So however long you're in shifts, same time in the water wash. Now, from this point, this is where the protocol changes. Yeah, so if you're doing a PASH, and the PASH is for polysaccharides basement membranes, then you're going to counter that PAS with a hematoxylin. So remember that a counter stain has a specific target where a background stain just lays over everything. Okay, so this is truly a counter stain. So you're going to go into Harris hematoxylin and it's going to tag your nuclei for you. Then you're going to water wash. That's going to remove that excess hematoxylin. Then you're going to go into bluing to blue that hematoxylin. Then you're going to water wash to stop that bluing. It's just like your H&E coming out of a progressive stain. So once you've blued, then you're going to DCM. So your results, your glycogen and your basement membrane will be rose, and that's from the shifts. And then your nuclei are going to be blue-purple from the hematoxylin. So this is what it looks like in the end. So this is kidney, and you need this really nice rose pink basement membrane. And then here you can see some glycogen. Yeah, and then you have your nuclei that are purple, and you can see that chromatin detail. Now, if you over do your hematoxylin, you're going to have this purple effect as opposed to a rose effect. You may have some bleeding, hematoxylin bleeding, and that's coming out of your nuclei and sort of interfering with your shifts, so that your basement membranes will be more purple. And that's not something we want. So make sure that you're working up that hematoxylin as diligently as you're working up that shifts. So this is a PASH that has picked up fungus. So if you by chance have any fungus that's in your section, it's going to pick up that shifts as well. So that's what this is over here. It's an arbitrary finding, meaning we weren't expecting to see fungus in there, but surprise, there's fungus in your section. So the fungus is this long pink stuff, and it's picked up that Schiff's reaction. Yeah, and then you have your nuclei in the background. Again, that's an arbitrary finding, but it does happen. Now, the other thing that's interesting is a PAS positive tumor. There are glycogen-based tumors out there. So if you are, you know, staining a section and you see all these big blobs like this of a Schiff's reaction, that's actually a tumor positive, a glycogen tumor positivity. Now, if we're talking PASG slash PASF, remember it's the same thing. Then after our PAS reaction, we are going to background stain. It says counter. I should change that. Yeah, but we are going to background stain with either a light or a fast green. Really, a light green and a fast green are the same. It's the same chemicals used. Yeah, it's just different recipes. And the fast green is a little bit darker than the light green is. So we're going to counter with, I use a light green. I feel like I have more latitude with it. So that I don't overlay my PAS with a fast green. And because it really is a fast stain if you use fast green. What can happen is if you overdo this step, meaning you're in there too long, you can lay the green over the top of your Schiff's reaction, creating this sort of really muddy looking purpley, dark purpley color. And we don't want that. Yeah. However, should that happen to you, yeah, you can actually pull that light green. So there's in the water wash afterwards, you can remove, that's just removing the excess green from your slide. But if you've overdone your light green, you can, in fact, yeah, sit in this water a little bit longer and it will pull out some of that green. As well as when you go into your alcohols during your DCM process, yeah, you can utilize those alcohols to pull some of your green as well. So you kind of have to keep an eye on your slide in this water wash. You absolutely need to remove the excess green that's there off of your slide. But you don't want to pull too long in either your water wash or your alcohols, because it will, if you go too long, it's going to pull all your light green. So you have to move along fairly quickly once you've hit this point. So after you get it mounted, your results, your fungus are going to be rose, and everything else is going to be green. So this is what it looks like. This is filamentous fungus. And yeah, so the fungus is this, rosy pink color, and then everything else is going to be green. This is a lung that has fungus in it. It's a bronchitis type thing. Yeah, so, or an ammonia type thing. So you can see this is budding fungus as opposed to the long strands of fungus. And we'll get through that differentiation when we hit microorganisms. But this is budding fungus in the alveolar sacs of the lung. And then you can see the actual lung tissue is background stained with that light green. So this is another budding fungus. So it's just closer up. Yeah, so you can see the fungus is pink. And in this one, the light green is it's sort of light in the background, yeah, and that's great. But you can also see that within the fungal capsules, it's staining a little green as well. This is thrush, and so this is oral thrush, yeah, also known as the kissing disease, also known as trench mouth. So down here, you can see the light green counter. This is the top of the tongue. And this is all the fungus that's overlaying on the tongue. That's that, yeah, if you've ever had trench mouth, you get this sort of big, thick white layer growing inside of your mouth. And it's sort of sticky and icky. Yeah, and that's all the fungus that's on the top of the tongue. So then we have the PAS with digestion. So this protocol is ran exactly like the PASH. Okay, it is a PASH. The difference is that you're going to have two patient slides, and your controls, and one of the patient slides, so they're identical sections. And remember that I said that if you do this in the laboratory, they have to be identical sections. So when you pull your slides, to run this from behind the board, make sure that they are identical sections, that you don't have, one PAS control that's one tissue type and another PAS control that's either a different tissue type or a different cut. You have to have the same cut, okay? What you're going to do is you're going to take one of those slides and you're going to label it with a W, that means with. You're going to take the other slide and you're going to label it WO, which means without. So you're going to depair and hydrate, but then prior to starting the PAS reaction, you're going to digest the slide that says with. And you can use amylase or you can use human spit. Yeah, there's amylase available for you. Yeah, it's in the freezer. So there might be some made in your refrigerator as well. So you put the with slide in the amylase, or you spit on it, and you digest out that glycogen. Then you rinse off that slide, and then you take your without slide, you put them together, and you run the PASH. Okay. So this is what it looks like. Yeah, so this is a PAS without, and this is a PAS with digestion. So all of these little pink granules that you see, and these are identical sections. So all of these little pink granules that you see on this side have been digested out and left behind on this side. So these guys that are still pink here aren't true glycogen. Your true glycogen is, the stuff that has been digested. So when the pathologist looks at this, side by side underneath the microscope, he can actually determine how much true glycogen is in that specimen. This is another one. So this is a degenerative lesion of the liver. Yeah. Yeah, so you can see this is the one with digestion, and this is the one without digestion. So you can see the huge amount of glycogen that is actually present in that patient. Again, the pathologist is going to look at this side by side, yeah, to see how much glycogen truly is in that lesion or that tumor. All right. Now we're shifting from the PAS to the Alcium blue. Just like the PAS, the Alcium blue has different derivatives of the same stain, or I should say an Alcium blue reaction. So there's variations to it as well. We have an Alcium Blue 1.0, and the 1.0 is going to stain sulfated mucosubstances. The 2.5 is going to stain acid mucosubstances. Now, look at this. Mucopolysaccharides, mucosubstances, mucins, yeah, they are all the same thing. This is one of those Carson interpretations we were talking about earlier. Um, don't let the book throw you. The Carson will interchange, yeah, the terminology. So she may say mucins, she may say mucosubstances, she may say mucopolysaccharides. It's all the same thing, okay? So don't let that throw you. So we have the 2.5, that's acid mucopolysaccharides or acid mucosubstances. Then we have the Alcium Blue PASH. This is in the correct order where you are going to run an Alcium Blue and then you're going to, it's called a tag. You're going to tag it with a PASH. Now, again, you're going to see this sort of flip-flopped. Some people call it the Alk Blue PASH. Some people are going to call it the PASH Alk Blue. So this is to differentiate between neutral and acid mucosubstances, or mucopolysaccharides, or mucins. Then we have another digestion. So this is the Alcium Blue with the hyaluronidase enzyme. Anytime you see ASE, just like amylase that you digest your PAS with, anytime you see ASE on the end, it's an enzyme. So we're going to use hyaluronidase to digest. So this is to differentiate between epithelial and connective tissue mucins. All right. Something important to remember. The pathologist cannot tell the difference microscopically between a 1.0 and a 2.5. These are different pH Alcium blues. So he's really counting on you and counting on your training to be accurate. You cannot switch these. There's two different solutions of Alcium blue. One of them is the Alcium blue, the solution is an Alcium blue 1.0. That Alcium blue 1.0 is hydrochloric acid based, okay? The Alcium blue solution for the 2.5 is acetic acid based. So that's how they're going to pick up on the different mucins. So, and it's based on pH. So you cannot take the solution, the 2.5 solution, and use it in the 1.0 stain. You cannot take the 1.0 solution and use it in the 2.5 stain. You have to make sure that you keep those Alcium blues in the right stain, okay? Otherwise, you're going to give your patient either a false negative or a false positive. Do not interchange those solutions. So check, and recheck to make sure that you are using the correct solution with the correct pH for your stains, because the pathologist can't tell, okay? Now, we're going to start with the 1.0. So the Alk Blue 1.0 is demonstrating sulfate mucopolysaccharides or mucosubstances or mucins. We're using a hydrochloric acid based solution at a 0.1 normal, which gives it a 1.0 pH. So your fixative is your average everyday tissue, 10% neutral buffered formalin. You can use for a control colon, small bowel, or appendix. Colon is sort of the go-to just because it's beautiful microscopically, and it's actually the go-to for the 2.5 as well, because it's also beautiful microscopically. So I sort of think of this in terms of what I'm seeing microscopically. Yeah, so the 1.0, you're only staining one thing, one mucosubstance. So that's what I'm seeing microscopically. So our protocol, you're going to depair and hydrate. Yeah, then you're going to go into a 0.1 normal hydrochloric acid. This is going to start to introduce that hydrochloric acid to the tissue, because your alcium blue that follows this is hydrochloric acid based. Now you're also maintaining the pH of that alcium blue that's going to follow this. You don't want to drag. If you went from water here and went directly into the alk blue, you're going to drag water into that alk blue and you're going to change the pH of it. So we don't want to do that. We want to maintain the pH of this alcium blue. So we're going to introduce that hydrochloric acid, then we're going to move directly into the alcium blue. And because we've already introduced that hydrochloric acid, we're going to maintain this 1.0 pH. So you're going to go directly into that alcium blue. This is your stain for those mucose substances. It's a sky blue color. It's really a beautiful blue color, the solution itself. Then from there, we're going to go right back into a 0.1 normal hydrochloric acid. You cannot use this and then use it for this. So these have to be two different Copeland jars or two different floodings, okay? You can flood your slide, meaning you have solution that you just squirt on, your slide's laying flat, you have solution that you just squirt onto your slide and let it sit. And you can do that, here, you can do that here, you can do that here. But you cannot use this hydrochloric and go into here and then go back into this hydrochloric. Okay. So this particular, the hydrochloric after your alcium blue, is going to lock in that alcium blue. So it's going to react with that alcium blue so that it will stay in your section in the remaining subsequent steps. Now, this is one of the, after we've rinsed, this is one of those times. Yeah, remember when we first started talking last quarter, I told you never let your slide dry out because it's going to cornflake. That is absolutely true 99.9% of the time. But this is one of those times, when we actually are truly going to let our slide dry out. So we're going to blot our section. We're going to blot it dry. And when I say blot dry, if this is my slide, I'm not going to take a piece of tissue or a chem wipe and go like this, because you're going to ruin your section. What you need to do is put a chem wipe down on the counter, and then you're going to take your slide and you're just going to drop it, okay? And you're going to let it sit. Yeah. Notice that we don't want to rinse because that water is going to sort of reduce the amount of staining, but it's also may give you non-specific staining due to that pH change. So if we change the pH, then more than just the sulfated mucosubstances are going to start to appear. Okay. So we want to blot it dry. I actually will air dry it. So a couple of different ways. You can drop it, and let it dry. And let me give you a trick of the trade if you do that. If you do that, when it's dry, take your finger and just press on the bottom of the slide, and the slide will kind of pick up a little bit. And then just with your finger, grab the other end and stand it up instead of trying to swipe it off like this. So you're going to bloop, and then you'll take your finger, when it's dry, take your finger, press on that end. This end of the slide will lift, reach your finger down, and stand it straight up. Now, I tend to do it a different way, same effect, but different different way to do it, different way to dry it. I will actually take it to the hood, and because there's air circulation in the hood. And I'll put down a paper towel, and then up against the side of the hood, and then I'll just prop my slide up against the wall of the hood, but I make sure that my section is facing the wall. So it's sort of leaning up against the wall like this, as opposed to having the section out facing into the circulation of the hood. And the reason I do that is because there may be, dust or, other chemicals sort of floating around. I mean, that's what the hood's for. So I want to make sure that I'm sort of protecting that section, from getting, dust and particles all over it. So I'll lean it up against the wall, not directly against the wall, but enough for airflow to go in between the section and the wall of the hood. And I'll just let it sit there until it dries. Now, we are not going to rinse after this step. Because that water may bring in a different pH. So we're going to go directly into our counter stain after that. And this is a true counter stain. It has a tag to it. And that's NFR, or nuclear fast red. And it's going to stain your nuclei red. Then you're going to distill water wash. And the water here is in fact important, to, you can actually, at this point, you can, because you've already set your alk blue. So you can actually use a tap water here. Don't let Carson confuse you. She does say distilled water, but remember there's 3 times we use distilled water. And that's microorganisms, silvers, and immunohistochemistries. So this distilled water is going to remove any excess NFR. Now, the reason for this water wash, and this is, you've got to make sure that the NFR is gone. The excess NFR off of your slide. Because if you leave any excess NFR, what's going to happen is when you start to DCM, you're going to see this sort of white cloudiness that starts to happen on your slide, and it'll be all over your slide, the glass of your slide. And that's because you have excess NFR still left in your section. So be advised, okay? Then you're going to DCM. Your results are your sulfated mucosubstances are going to be blue, and your background and nuclei are going to be a red to a pink color. And this is what it looks like. So I've got this beautiful sky blue color happening. And then you've got your red nuclei. So then we have the 2.5, the alk blue 2.5. This is going to demonstrate both the acids and the sulfated mucosubstances, mucopolysaccharides or mucins. So again, you're demonstrating two things. So I sort of look at it as what I'm going to see microscopically. So we're seeing two different things, two different blue eyes, as opposed to just one blue eye when you're running the 1.0. Now, another trick, when you're running the 1.0, you're demonstrating one thing. When you're running the 2.5, you're demonstrating two things. Yeah, so if you just look at that number, it will tell you, it'll sort of prompt you to what you're staining. So again, 2.5 acid and sulfated. Yeah, your fixative is NBF, and your control, small bowel colon or appendix. Yeah, and most people like to go for that colon because it's beautiful. All right, so this one is much easier. Yeah, we're going to depair and hydrate. We're going to introduce that acid environment, yeah, but this time it's an acetic acid, not a hydrochloric acid. Yeah, and it's a 3%, so it's sort of a weak acid. And it's going to maintain the pH just like in the 1.0. It's going to maintain the pH of your 2.5 alk blue stain. So you're going to go straight from your 3% acetic acid into your Alcium blue. This is your stain. Then you're going to come out of that Alcium blue and you're going to go back into a 3% acetic acid. Again, you can't interchange these two. And this is going to lock in your stain. It's going to prevent non-specific staining by maintaining that pH. Yeah. Now this one you don't dry out. You go right into a running water. And this is this 2.5 is much like the Schiff's reagent. You have to develop it. Yeah, you will see blue staining when you come out of here. Yeah, but once you start running it in tap water, you're going to see this bright, beautiful blue start to show up. Yeah. Anytime you're developing, that is a great holding spot. Yeah, so this right here, you can drop your slide, go tend to other things, and come back to it. From here, we're going to go into NFR, same counter stain as we used before. Then we're going to water wash to remove that excess NFR. Same story, same song and dance. If you don't remove the excess, yeah, you're going to see this white cloudy white cloudiness start to appear on your slide. Then you're going to DCM. So your results, your acid and sulfated mucopolysaccharides, mucins, or mucosubstances are going to be blue. Your nuclei are going to be red. So you can see these results are exactly the same, with the exception of the acids. Yeah, because you're staining two, right? As the 1.0. So microscopically, the pathologist can't tell the difference. So again, on this one, you're staining 2, on the 1.0, you're staining 1, but microscopically, your pathologist can't tell. So a couple of notes, tidbits in terms of the ALK blue. That's both ALK blues. Yeah, the blue in the Alcium blue is due to copper content. So if you think about like the Statue of Liberty, okay, like metal roofs, copper roofs, roofs or roofs, however you want to pronounce it. Yeah, statues, okay. Anything that is copper, when it is left outside, in the rain, yeah, it's going to turn eventually blue, this sort of blue, greeny color. It's the same sort of concept, okay? So it's the copper that is in the Alcium blue powdered dye that creates this blue color. Now, the times that you are in your Alcium blue solutions really vary depending upon the concentration of the concentration and purity of the original powdered Alcium blue that's ordered into your lab. This is what the 2.5 looks like on a colon. It's absolutely beautiful. Yeah, all of these mucose substances are stained this beautiful blue, sky blue kind of color. And then you can see your nuclei surrounding it that are stained with the NFR. Then we have the Alcium blue with hyaluronidase. Again, this is a comparison study. So you're going to have 2 patient slides, identical sections. So this is what's going to demonstrate between epithelial and connective tissue mucins. So it's a digestion stain, just like digestion on the PAS, except you're going to digest with hyaluronic acids. So once you digest with the hyaluronic acids, you're going to leave behind glycoproteins that are going to be demonstrated. So this one's kind of weird, because you need to have 3 different controls to go with your patient. You need to have one that's been digested with hyaluronidase, one that has not been digested with hyaluronidase, and then one colon, that's going to demonstrate the epithelial mucins. Okay, so you have non-digested, digested, and you have your epithelial mucins to prove that the stain worked. So again, 10% NBF is our go-to. You're going to have 2 umbilical cords. So those are your 2. The one that has not been digested, the one that has been digested are umbilical cords. Then you're going to have a 3rd slide, which is colon, that's going to demonstrate your epithelial mucins. Those are your controls. Then you're going to have 2 patients as well. All right, so our protocol, you're going to actually have a buffer, a warm Copeland jar of buffer. And I say warm, not hot, okay? Some people will just take their buffer and just use it at room temperature, and that's fine as well. Now, this buffer is a potassium phosphate monobasic and a sodium phosphate dibasic. It's just the buffers that are used in 10% NBF, okay? So you're going to have 1 Copeland jar of buffer, 1 Copeland jar of hyaluronidase. The hyaluronidase does need to be warmed up, okay, to 37 degrees Celsius. So I just take mine and just zap it in the microwave for about 10 seconds and I'm good to go. You just barely warm. Now, the other way that you can do this is by utilizing the water bath. So there's a black round water bath in the lab. And you can take your buffer solution, your buffer solution, put it in a Copeland jar. You can take your hyaluronidase, put it in a Copeland jar, heat up that round black water bath, and then put both Copeland jars in there. Then drop your slides that are going to be digested into the hyaluronidase. and then take all of your other slides and put it in your buffer. Turn on your water bath, walk away. Okay. This gives you a lot of latitude to get other things done, as opposed to heating up a Copeland jar of high hyaluronidase and digesting really fast. The water bath is actually the preferred method. So just drop your slides, leave them in the water bath, walk away for an hour, and come back. Okay. So, but before you drop your slides, okay, yeah, you're going to depair and hydrate. Then you're gonna, of course, right? So you're gonna depair and hydrate. Then you're gonna drop your slides. Yeah. So what this is saying to you is it's going to take about an hour for your Copeland jars in the water bath to actually heat up to the right temperature. And in the meantime, you can depair and hydrate, do other things, and then come back, drop your slides, and walk away. Now, Carson says 2 hours. Really, once you have a little bit more latitude than that, okay? Because your slides are in a buffer, nothing's going to happen to them. You drop your slides into the hyaluronidase, and you can't really over digest. I mean, once you've digested, you've digested. So yeah, you can let them sit there for 2 hours, but you can, you have some latitude. I mean, oh my gosh, if you're in it for 2.5 hours, it's not going to make that big of a deal. Which leads me to, my brain just sort of went sideways a little bit, but that on an off topic, it leads me to another point. When you start running special stains, I see it every single year. When you start running special stains, it seems like, with new students that you set your timer, right? And then, oh my gosh, you're looking at those seconds, right? Oh, we've got 20 seconds left to go, and you're on the countdown. 3, 2, 1, pull the slide, pull the slide. It doesn't work that way, you guys. Be calm, okay? You have latitude, okay? You don't have to go on a countdown. And oh my God, pull the slide. Oh my God, pull the slide. You have leeway. If you're across the room and your timer goes off, it's okay. Just walk over and pull your slide. It's not a do or die type thing. Okay. And I don't mean DYE, huh? Pardon the pun. But it's not a do or die type thing if you aren't right there, when that timer goes off. That time, the time frames of these things have latitude. Okay. So oh my gosh, you don't have to panic. You don't have to be right there watching the timer tick down. Okay. Yeah. So try to relax yourself and realize that there's enough time for you to get back over and do something before your stain is going to be ruined. Okay. Yeah. I mean, you can even be in the classroom working on the computer and, oh, my timer went off. You get up, you walk in, you take care of your slide. Okay. Okay. So that's a sidebar. All right, so you're going to sit for at least 2 hours. Again, because you have 2 hours, this is a good holding solution or holding spot to give you latitude to go do something else. You do not have to sit in a chair next to your hyaluronidase for 2 hours doing nothing to watch it. Okay. It's like watching a pot boil. You don't have to do that. So then you're going to pull all your slides, and you're going to water wash them. So you're going to remove the digestion from the ones that were in hyaluronidase, or you're going to remove that buffer solution, for those that were sitting in buffer. Then you're going to, basically, you're just running a 2.5 afterwards. Yeah. So you're going to place all the slides in a 3% acetic acid to introduce that acid, maintain that pH. Then you're going to go into Alcium blue. This is your 2.5 stain, so it's going to stain both of your sulfated and acids. Then you're going to water wash. It's interesting to me, and I can't explain why, but there is no bringing it back out to lock in that stain right here. In terms of going into another 3.3% acetic acid. I don't know why Carson does that. I can't explain that. But whenever I digested an Alcium blue, I did. I would go from my, just like a 2.5, I would go 3% acetic acid, Alcium blue, 3% acetic acid to lock it in. Okay. Then you're going to water wash, develop that blue solution. This is another good holding spot. Yeah. Then you're going to counter with an NFR. That's your nuclear stain, your red nuclear stain. Then you're going to water wash to remove that excess NFR and DCM. So your results. Without digestion, your mucopolysaccharides, mucins, are going to be blue. Your nuclei are going to be red, and your connective tissues in the background are going to sort of be a pink color. That's why Carson says red pink, because your nuclei are going to pick up the red color, but any connective tissues in the background will be this really light pink. Then without digestion, or I'm sorry, with digestion, you're going to have a loss of blue staining, and you're still going to have the same results from your NFR. Your colon is going to have blue epithelial mucin staining, and again, the same results with your NFR. And again, this is a comparison. So what is hyaluronidase? Well, hyaluronidase is an enzyme that's used for digestion. It can be derived by animal, or it can be derived by human, or it can be synthesized in a lab. Most of them now are synthesized in a laboratory. So now we have your ALK blue PAS, or your PAS ALK blue, depending upon who you're talking to. Okay. So this is going to differentiate between acids and neutrals on the same slide. Okay. Beautiful stain. So our go-to is a 10% MBF. Your control is a kidney, or a mucin control, meaning that it can be colon, small bowel, or appy. I prefer colon because it's just gorgeous. However, your choice of control is really based on the type of tissue that your patient is. So if you have a patient that is kidney, then you want to pick a kidney control. If you have a patient that's colon, you want to pick a colon control. Small bowel, you want to pick a small bowel. Appendix, you want to pick an appendix. But for your purposes, when you run this stain, if it were me, I would do a colon because it's just absolutely beautiful in the end. So for this one, again, I, am I'm always thinking about what I'm going to see microscopically. So it's pink and blue. So, here's your pink and blue eyeball. And essentially what this is the ALK blue 2.5 that's tagged with a PAS reaction. So our protocol. We're going to depair and hydrate. Yeah, we're going to go into just like the 2.5. Okay. We're going to go into a 3% acetic acid to introduce the acid and assure the pH of the Alcium blue solution that follows. So 3% acetic acid straight into your Alcium blue. This is going to stain your acid mucosubstances. Substances. Then you're going to lock it in and prevent nonspecific staining with another 3% acetic acid. You're going to water wash to develop that blue color and remove the excess stain. Okay. This is anytime you develop, this is a good holding spot. After this water wash, then you're just going to tag it with a PAS. So you're going to go into your periodic acid, that's your oxidizer creating that aldehyde. Yeah, then you're going to water wash. That's going to remove that excess periodic acid and stop the oxidation from continuing. Then you're going to go into your shifts. Excuse me. That's going to stain your neutrals. Okay, so see up here, your Alcium blues staining your acids. Your shifts is going to stain your neutrals. Then you can take the optional lazy step if you prefer, and go straight from your shifts to your metabisulfite. Yeah, this is going to assure that you don't have any non-specific staining from your shifts. Then you water wash. This is going to develop that shifts. Yeah, and this is a good holding spot. Again, whenever I'm developing, this sort of mindset that I have is however long I'm in this blue is how long I need to develop that blue. However long I'm in this shifts is how long I need to develop that shifts. So we develop that shifts, by running. Anytime you develop, it has to be a running trickle of water into the Copeland jar. Yeah. Trick of the trade in terms of that. When you have slides that you're running through water, put it under the sink, turn your water on, and when the trickle, and I don't mean a big flush, right? Just a little trickle comes out of the tap. Put the trickle on top of the glass rim of the Copeland jar, and it will flow into the Copeland jar and out the other side. Don't put the trickle directly over your slides, because it's too much movement, if you will, and it can wash away your sections. It can lift and wash away your sections. So that little trickle needs to be on the side of the glass, to prevent that sort of violent washing that happens if you go directly over the top. Good trick of the trade. Okay, so water wash to develop the shifts. Then you're going to go into a Harris hematoxylin. That's going to be your nuclear stain. You're going to water wash to remove the excess hematoxylin. You're going to blue it. You're going to water wash to stop that bluing, and then you're going to DCM. So your results. Your acid mucosubstances are going to be blue, and your neutral mucosubstances are going to be rose, and your nuclei are going to be purple. Now, tidbits. You can actually stop this stain after step 10 and DCM at that point, leaving the hematoxylin out. So if we go back here, you can stop right here after you've developed in this holding spot and go directly to DCM. Or you can run the PASH. Okay, so you can do the 3.0, or I'm sorry, the 2.5, and go all the way to here. Then you hit it with the PAS reaction only. Okay. And you can finish it with a DCM, or you can run a PAS reaction and a counter of hematoxylin. So it really depends on um going the wrong way. It really depends on your pathologists and what they prefer. Some will prefer to see those nuclei. Some really aren't too concerned with it because they're really just looking for the neutrals and the acid mucosubstances. So it's pathologist dependent. But if you're asked for the whole protocol, yeah, it's the whole thing, right? All right, so this hematoxylin, you're going to see this throughout Carson. And she's going to say to put a couple drops of acetic acid in your hematoxylin. That is because acetic acid is really a binder. And so in terms of your hematoxylin, it acts like a binder. And so by putting a couple drops of acetic acid in your hematoxylin, it helps that binding process happen with your hematoxylin. The reality check, though, is that most of your manufactured hematoxylins already have acetic acid in them. So you really don't have to worry about it. It's kind of one of those Carson's throwing you for a loop type thing. But just know that that's why she's saying acetic acid. Okay. Now you can or cannot blue. Okay, with this. We are running the hematoxylin counter progressively. And so you can, if you go into Harris here and you water wash here, you can go for a longer water wash and utilize this water wash as a bluing step. Meh. Me, I prefer just to get rid of, my excess hematoxylin, give it a couple steps in bluing, stop that bluing in DCM. But you can give it this long water wash right here to blue. Now, because we are staining for acids and neutrals, there are going to be areas within the cell that may have both. Yeah, so if you combine blue with pink, you get purple, right? So you could have these sort of combo shading areas where it's sort of this deep purple. And that's okay, because it's just because you have both of them located in one place. So this is what it looks like. So you can see the Schiff's reaction, the neutrals right here, and then you can see the acids here. This is a colon. This is why the PAS alk blue is so beautiful on a colon. So here you have your neutrals, that's these pinks. Then you have the beautiful sort of sky blue acids. But then if you notice, there are areas that are sort of dark purple, and that's where you have both your acids and your neutrals in the same area. All right. So moving on, we have the colloidal iron. Yeah, so this is demonstration of carboxylated mucopolysaccharides and sulfated. Yeah, so when carboxylated just means acids, really. Yeah, and sulfated just means neutrals. Uh, plus, are glycogen proteins. Yeah, so NBF. Again, our control is colon, appendix, or small bowel. So we're going to depair and hydrate to water. We're going to go into a 12% acetic acid. This again is introducing the acid and it's preventing water dilution into your working colloidal iron solution. So 12% acetic acid into working colloidal iron. This is your stain. However, when you come out of this, your slide is still going to remain clear, okay, until we bind it later to produce a color. So you're going to come out of this colloidal iron solution. Yeah, you're going to go into another 12% acetic acid. Same story as with your Alcian blues. This is going to lock in this colloidal iron. Then from here, you're going to go directly into a ferrocyanide hydrochloric acid solution. This is going to bind with the colloidal iron to produce a color. And this ferrocyanide reaction is called a Prussian blue reaction. You have to make this fresh. Um, and when I say fresh, if you cannot make this at the beginning of the day and use it all day. You really need to mix this and use it within, 5-10 minutes because because it'll start to turn, it'll have the reaction start to happen. If this solution turns a sort of greeny blue color, it's toast. Okay. So keep that in mind. It should be sort of a yellowy blue color. Okay. So you're going to go into this, it's going to make that Prussian blue reaction happen. Then you're going to water wash. This is going, oh, there's a 9 there. This is going to remove any excess of these that may still be on your slide. Yeah, preventing non-specific staining. And this is a hold spot. Okay, so you can hold here, go tend to other things. Then you're going to counter it with NFR. That's your nuclear stain. Water wash to remove that excess NFR, and then DCM. So your results, your acids are going to be blue, your mucins are going to be blue, and your nuclei are going to be red, and then that cytoplasm and connective tissue in the background are going to be pink. A few tidbits over here. So your working colloidal iron in the beginning. So this one and this one need to be made fresh, okay, and then used right away. Oopsie. Uh, Now, instead of, well, if we go back, instead of countering with an NFR, that's usually the go-to, but you can, I keep going, but you can also counter with a PAS reaction. Yeah, in some cases, your pathologist may want that, but really the go-to is going to be NFR. Now, should you have Cryptococcus neoformans, it will also stain blue, and that's another arbitrary finding, but it will also uh, stain blue. So this is what it looks like. So all this blue stuff is your iron, and then you have your NFR counter stain. Here's a couple more. So here's that iron that has turned blue. And then you have the NFR counter. Same deal over here. Somebody has esophagus. That's what this is. Yeah, so you can see the cartilage underneath has stained blue just because it's bone, right? And there's iron in bone. Well, I shouldn't say it's bone. It's cartilage, truly. But there is iron in the cartilage, and then you can see the iron deposits on the edge of the specimen edge. The my brain isn't working. Anyway, okay. So Cryptococcus neoformans is a skin infection. This is what it looks like. It's cocci, it's a bacteria. And yeah, so arbitrary finding. Okay. This is what neoformans looks like under EM. And yeah, it's really kind of cool looking. Anyway. So there is also Cryptococcus meningitis, and so this occurs in the brain. And so there's little cystic lesions that are in the brain. That's these little holes that the Cryptococcus is growing in. And that, again, arbitrary finding. So then we have the Mayer's mucicarmine. Now, the Mayer's is staining mucins all the way across the board, okay? Any mucins. So we have a 10% MBF. Yeah, you're going to hear text just call this the mucin stain. So just an FYI tidbit. Yeah. Your control can be colon, small bowel, or appy. I like colon, okay? So we're going to depair and hydrate. Then we're going to go into a hematoxylin. This is the first time you guys are going to use Weigert's. So Weigert's is a nuclear stain. Yeah, remember it's that black special stain, nuclear stain. It's equal parts of solution A and B. Please note, I've always been taught that A is the hematoxylin and B is the ferric chloride, which is the oxidizer. Yeah, and Carson's going to flip-flop that back and forth on you. It needs to be made fresh daily. So I used to make mine in the morning, and I would use it throughout the day. Yeah, and then discard it, and the next day make more Weigert's. Now remember the things that I've taught you before about Weigert's. It's thick, it's black. Yeah, and as you flood your slide with it, okay? And as it sits on your slide, it's going to oxidize. And so around the edges, you're going to potentially get this black, grainy stuff that's going to stick to your slide when you wash it afterwards. And so some pathologists will look at that and say, oh, this is a failed slide, and automatically kick it back. So what you need to do is just take your chem wipe and just wipe that stuff off your slide and move on. Now, Weigert's for me, is somewhere between 7 and 10 minutes-ish. Yeah. Weigert's, remember that Weigert's is a different animal than all the other hematoxylins. I would start, somewhere between 5, put it in, 5 minutes, put it in water, look at it microscopically. If it hasn't stained to your liking, you can always take it back into Weigert's and go a couple more minutes, water wash it, check it under the microscope, see if it's where you want it. So yeah, whatever time you are in this Weigert's is pretty much how long you need to water wash afterwards. And this is a good holding spot. Okay. So remember that we can stain with Weigert's hematoxylin at the beginning of a stain because it has the ability to withstand subsequent staining. So yeah, just another little tidbit there. So you're going to water wash, you're going to remove all the excess hematoxylin. Take a look at your slide at this point, the glass on your slide at this point, yeah, to see if you sort of have that black grainy staining. If so, wipe it off. Then you're going to go into your Muci carmine. So, yeah, this is the first time you're actually going to use, other than hematoxylin, you're going to use a natural special staining dye. It's alcohol based. So you have to make your working solution fresh on a daily basis. Yeah, this is a beautiful red color. Um, you know, when I used to do this stain, it's based on from lab to lab, how it works up. But when I used to drop in my Muci carmine, um, I would leave it there for 45 minutes to an hour. And then I would water wash it, take a look at it, see if it's deep enough. If not, I would go back into my Muci carmine, and continue to toggle. So this water wash is just to remove excess stain, excess muci carmine. It's a great holding spot. Then you're going to go into methanol yellow. Some people like to call this mental yellow because it can be very tricky. It's just simply a yellow background stain. Yeah, but it pulls really easy, yeah, in water and in your alcohols. So keep your eyes on it as you're going through those. You're going to water wash after your methanol yellow. Yeah, I just go real quick, bloop, 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 and move on. Then you're going to DCM. So your results, your nuclei are going to be blue-black, your mucins are going to be red, and other elements are going to be yellow or slightly tinged with that Weigert's hematoxylin. Now, some notes. Again, cryptococcus will show up. Yeah, if it's if it as an arbitrary finding, if it's actually there. If you overstain with Weigert's, there's really no coming back from it. You can overstain with the hematoxylin or you can overstain with the yellow. Okay. If you've overstained with that Weigert's and your whole section is this muddy black color, chuck it, start over. Okay. If you overstain with the yellow, you can use that water wash to sort of pull some of that out for yourself. Now, again, you can toggle throughout this entire stain. So, you go into your Weigert's for a shorter period of time, you go into the water, you check it microscopically. If you don't like it, you can go back into the hematoxylin and make it darker, okay? And toggle between that Weigert's and the water wash afterwards. When you go into your mucin, drop your mucin, come back to it again, 45 minutes to an hour, drop your mucin, wash it in water, put it underneath the microscope, see if you like the color of it. If you want it deeper, then go right back into your into your Muci carmine. If you go into your yellow, and you don't like the depth of your yellow, same thing, go into that water, check it microscopically. So you can check all the way throughout this stain, okay? The only time, even during your DCM, if you see like that yellow pull, you can go back and, back through your alcohols, wash it in water and go back into your yellow, okay? You, once you hit xylenes are sort of that stop point. Once you've hit xylenes, and you've cover slipped it, chances are you're not going to be able to repair it. Yeah, but there was an incident that happened a couple years ago where a student had cover slipped the mucin, but had not gone in, had forgotten the methyl yellow step. And so we gave it a whirl, yeah, and we soaked it in xylene. We went, all the way back to water, washed it in water, put it in methyl yellow, and we did get some pickup of that methyl yellow. Not as bright as we would have liked it, but it did work. Okay. So this is what it looks like. Yeah, your nuclei are going to be this sort of black color. Yeah, your mucins are going to be red. Yeah, and then you have in this instance, you sort of have that muddy green kind of thing because the Weigert's is sort of bled a little bit. This, however, is gorgeous. Both of these two are beautiful. Yeah, so you have your mucins, you have your beautiful Weigerts, and then you have this nice bright yellow background. Yeah, this is on a lower power. Yeah, so everything is in place. Yeah, you can see the black Weigerts. Yeah, you can see the mucins. Yeah, and you can see the yellow coloration. All right, so mucin, uh, it comes, or carmine, mucicarmine. The carmine comes from the cochineal beetle, and it's the larvae on the cactus itself, that are harvested. And there are actually cochineal beetle farms here in Arizona. I've had the luxury of going to visit one. Yeah, it's really kind of cool. And this is what they look like on the cacti. So this is up close. This is a female colony of the cochineal beetle that's currently maturing. Um, so yeah, each one of these is one of the little beetles. So those female beetles are harvested and they're dried. And this is what they look like. So each one of these little things like this is a single beetle. Now, more specifically, it's uh, the uterus reproductive system of the cochineal beetle that, when it's crushed, gives a red coloration. So my mind always goes, oh, okay, so who took one of these beetles, put it under a dissection scope, pulled out a beetle uterus, and then crushed it to see what was giving the color. I don't know. I don't know. Who thinks of that, right? So when you are buying dyes, the actual purity of the powdered dye depends on how many other cochineal beetle parts are within this dye. So you can actually buy um, pure carmine, which is very, very expensive, that is only the reproductive organs of the cochineal beetle, because they go in and they just pluck out, under a dissection scope, they'll literally pluck out the uterus. Very, very expensive. And then there's different grades, depending upon how much of the other beetle parts are in the powder itself. Yeah, there's tons of things that carmine is used for to dye. It's used in fabric coloration, even Easter egg colors. That's what it is. Yeah, things you eat have beetle juice in them. Your yogurts, your jelly beans, your jello, your cherry sodas, cherry Dr. Pepper, cherry Coke, that kind of thing. Lollipops, ice creams, Tomato ketchup is actually colored with beetle juice. Yeah, maraschino cherries are soaked in beetle juice. Vitamins even have beetle juice in them. Your dyed pistachios are dyed in carmine. Yeah, uh, red forest cake, yeah, is cochineal beetle. Licorice is cochineal beetle. I mean, you'd be surprised at how many beetle parts you eat. And lipstick, ladies. Yeah, lipstick is different shades and different purities, yeah, of cochineal beetle. And I love this, not to be confused with this Beetlejuice, right? We're talking about a different beetle here. All right, so some interesting gut information. If you're interested, yeah, sort of worth a watch. All right, so now we need to talk about amyloid stains. So amyloids are sort of like the blob. They Once they are established, the amyloid just keeps growing and growing and growing and getting bigger and bigger and bigger and engulfing the surrounding cells. Okay. So I sort of look at it as this starch-like blob, yeah, that just keeps eating at the organ. So there are um, 4 different classifications of amyloids. There's primary amyloid, secondary amyloid, myeloid association, and tumor association. So primary means, oh my gosh, all of a sudden, and we don't know really where the amyloid comes from, why it comes. But all of a sudden, boom, in an organ, whoop, we've got an amyloid. Okay, it's the first amyloid that's there. It's kind of like cancer, primary cancer. It's your primary amyloid. Then you have secondary. So this amyloid says, ooh, now that I'm established, I'm going to move over here. Okay, so this is secondary amyloid. Then it turns out that people who have myeloma tend to get amyloid. Okay, so that's where we get myeloma associated amyloid. Then we have tumor associated amyloids. So tumor associated amyloids is just that. Somebody has a tumor, and all of a sudden we start to see amyloids pop up. So our amyloid stains, we have the Congo red, we have the crystal violet, and we have the thioflavin T. When I was in histology school, my internship supervisor said something to me, and it always stuck with me. And that is, it's how I remember that Congo red is an amyloid stain. Is Amy Lloyd, right? Amy Lloyd went to Congo Bongo. Okay. Yeah. I don't know why that stuck with me, but it did. Maybe it'll help for you. All right. So the Congo red. The Congo red is a benzene derivative. And it reacts with cellulose. And it's a linear molecule. Okay. So keep that in mind here. Knowing that amyloid is starch-like, it's acellular, and it's starch-like. So the Congo red reacts with cellulose. Cellulose is a plant derivative, right? Starch-like plant derivative. So I find that fascinating. Yeah, because amyloids are starch-like, we don't know, and they're acellular, meaning they don't have a nuclei, and they grow like the blob, and they react to cellulose. We can tag it with, a derivative, a benzene derivative that reacts with cellulose. is this some sort of plant thing? We really don't know what it is, right? So very interesting. All right, so if you, according to Carson, you have to cut your sections at 8 to 10 microns. I always cut mine at 4, the standard 4 micron, and it still worked. But remember that when it comes down to it, yeah, for your certification, you always go with Carson. So your fixatives, you can use alcohol, you can use carnoids, you can use buins, or you can use NBF. Now, this is the one time that NBF can be a problem because the longer that your wet tissue sits in NBF, the worse staining ability that the amyloid has. So it decreases the staining ability. Now, that's not to say that, if you're fixed in NBF in the first place, just like normal, and you've been fixing for, 8 to 10 hours and you process, and you're still going to be able to demonstrate those amyloids. The problem comes if a pathologist comes back to you a week later on that case and says, oh, you know what? I want to put it through a gross recut from, the wet tissue, process it and run an amyloid stain. You're going to want to try to convince him not to do that, to go back to the original blocks to run that amyloid stain because that tissue's been sitting in NBF. Yeah, it's going to decrease that stainability. So our control has to be a known positive. Amyloid is not something that is just automatically in our systems. So you have to have a known positive. So you're going to depair and hydrate. Yeah, you're going to go into a Harris hematoxylin, some nuclear stain. Note that the counter comes first in this stain. And because of the fact that we're going to hit it with an alkaline solution, the Harris is going to be able to maintain throughout the stain. So, this is a good holding spot. In terms, it's actually this water wash, right? So you're gonna stain with your Harris, then you're gonna go into the water wash. This holding should be here in this water wash, okay? Yeah. So your water wash is your holding. It's just going to remove excess hematoxylin and blue for you. Okay. Now, interestingly enough, because this is an alkaline solution, this alkaline solution will also blue your hematoxylin for you. So you can just give, if you're not going to hold here, you can just give it a quick water wash, and this alkaline salt will blue your hematoxylin for you. But the true reason for this alkaline salt solution is so that we can release the internal hydrogen bonds and open up the binding sites in the amyloid and the cellulose so that we can tag it with the Congo red. So we're going to go straight from this alkaline salt solution to the Congo red solution. This is your amyloid stain. You need to filter it, okay? If you don't filter it, you are going to get all of these red particulates all over your slide. And it takes quite a while to filter this because this solution is very saturated. So make sure that I even used to filter it a couple of times. So I would filter it and then I'd change my filter and I would filter it again. And then it's got to be used fresh daily. Okay, you can't hold it and use it again until the next day. But you can use it throughout the day. So you're going to go into your Congo red. You're going to open up those binding sites. You're going to go into your Congo red, and then you're going to dehydrate really quickly, and you're only going to go in 100%. Do not hit this with water. Okay, if you hit it with water, all your Congo red's going to wash away. So you're going to go straight into 100%, and it's quick. Bang, 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 bang. And then poof, you're going to drop it in xylene, rinse it in xylene, rinse it in a couple changes of xylene and mount. Now, be careful, because you don't want to drag you don't want to drag through your hundreds. So you really, in your hood, you really need to set up a couple, a change or potentially two changes of 100 in a Copeland jar, and stay out of your H&E. Okay. Because you don't want this Congo red carrying over into other special stains or your H&E. So once you hit it with xylene, you're safe. Yeah, go through a couple changes of xylene, 2 or 3, and then mount it. Now, your results, your amyloid is going to be red under light microscopy, or it's going to have green birefringence under a polarizing microscope. Any elastic tissue will be a pale pink, and your nuclei are going to be purple. Now, if you have any excess Congo red, and this is why I say you need to filter, keep those particulates out of your solution, because if you have them, you can potentially give your patient a false positive result. When you are making your solutions, your alkaline salt solution needs to be saturated. It's very, very important. Okay. Your stain will not work unless it's saturated. Now, even though we have other amyloid stains that have been developed, Congo red was the first one developed. Even though we have other amyloid stains that have been developed since then, we still consider our Congo red the go-to, the most reliable special stain. So this is what it looks like. This is amyloidosis. Yeah, so here's your amyloids, your little blobs, acellular blobs. Yeah, and then here's your Harris hematoxylin. This is what it looks like in the brain. So here you can see the amyloids, and then you've got your nuclei. This is the exact same section as this. Okay, remember that the amyloids will fluoresce, with birefringence, and so this is what it looks like when we are under the polarizing scope. So here's another one side by side. So here's the amyloids, the reds are amyloids, and then here's the birefringence of those amyloids. Okay, then we have the crystal violet. Okay, it's really interesting to me because Carson calls it rapid screening. I'm not sure that I agree with that, because the crystal violet is an overnight stain. Okay. So I don't know. Okay. So past terminology, was that this is a metachromatic staining. Yeah, current terminology is polychromatic. Yeah, and here's the reason why. Because okay, because the solution is one dye that's giving off various shades of purple. However, the dye, the crystal violet powder, contains different dye components. So there's different dye components within that, okay, which so originally, ooh, we're giving off different colors, okay, but it's all different purple colors. It's not, like the Ginza, right? Where we're giving off grays and pinks and blues. It's all purple colors. Yeah. But yet at the same time, the crystal violet powder does in fact contain different components within that dye. So polychromatic, metachromatic, I don't know. Okay. It's a debate. All right. Now, this is not a permanent stain. Especially if you mount it aqueously. You can make it semi-permanently permanent. And I'll give you some tidbits on that. So when you do mount it, do not be surprised, if you come back a day later and all the purple has sort of seeped out of the section and into the surrounding media. Okay. Fixative is MBF, and because it's amyloid, we have to have a known positive. So really easy. You're going to depair and hydrate. You're going to go into your crystal violet solution. This is your amyloid stain, and other tissue elements, it says. Now, this crystal violet solution is what's called self-differentiating. So the longer that you're in it, the more differentiation is going to occur. So you're going to see these different shades of purple start to stand out. That's why it's best if it's an overnight stain, because the solution, the longer the section sits in the solution, the deeper purple the amyloid is going to become, and the lighter the other elements are going to become. So you drop it in, you leave it overnight. You come back the next day, you rinse it in tap water, just to remove the excess crystal violet solution, and you mount aqueously. Now, this is the temporary mount. Bleeding will in fact occur, meaning that, you let it sit for a while and all the purple is going to come out of your section. Now, there is a way to make it somewhat permanent. This doesn't mean that it's going to be permanent forever. Okay. But you can let it air dry. Again, go to the hood, prop it up, let it air dry. Then give it a dip in xylene, and mount it with synthetic resin. Bleeding will occur, but it's not going to occur as rapidly as if it were mounted with water. Okay. So your amyloids are going to be this purpley blue. Other elements will be blue as well. And this is what it looks like. So these blobby things that you see here, those are your amyloids. Okay. And this is done overnight. So you can see how the other elements have lightened up into sort of a pinky purple. Yeah. If you were to do this as Carson says, ooh, rapid screening. She's talking about taking a stain, dropping it in, or taking a slide, dropping it in there for 5 minutes, pulling it out, mounting it aqueously, and everything is going to be purple. Okay, everything is going to be this color purple. But I think what she's trying to get across is that it can be a quickie, meaning a quickie stain, meaning that everything is going to absorb that crystal violet. But with the trained eye of a pathologist, he can look at these acellular blobs and sort of go, oh, well, maybe this truly is amyloid. Let's do it again overnight and see. Okay. All right. So next we have the thioflavin T. Some tidbits about this. It's not as specific as the Congo red. This is why we always like to go back to that Congo red. Now, you're going to see that there's a differentiation step, but the thioflavin solution itself is not being differentiated. The differentiation step for the hematoxylin comes later on in the stain. So you stain it with hematoxylin, you go through a couple of steps, and then you differentiate your hematoxylin. So your thioflavin works best at a pH of 1.4. It's a fluorescent stain, uses Mayer's hematoxylin. And some structures are going to give off sort of a yellow fluorescence, but it will be distinguishable from the apple green fluorescence that we are going to see with the amyloid. All right, so you're going to depair and hydrate. You're going to go into Mayer's hematoxylin. So Mayer's, see this little guy down here? I always think about him. So what the Mayer's hematoxylin does is it's called quenching. It quenches the fluorescence of the amyloid. So because it's so thirsty, okay? I had a student say that it's so thirsty, and it's always stuck with me. So what quenching means is that the Mayer's hematoxylin is going to go into this amyloid, right? And it's sort of going to wet it down a little bit. And if you think about like a dry leaf, okay, you take that dry leaf and you put some water on it, and it sort of softens it up, okay, so that maybe later on you're going to, dip it in paint and, make one of those leaf canvas paintings. That's what quenching does. It sort of softens up that amyloid, to allow the fluorescence to move into that amyloid. So you're going to quench it. Yeah, you're going to water wash, and that's just going to remove that hematoxylin. Yeah, then you're going to go into your thioflavin T. This is your amyloid stain. Then again, oh, look, another acetic acid. This acetic acid, almost always when you see acetic acid in a stain, it's a lock, okay? So it's going to lock in that thioflavin, but this acetic acid, because it's a weak acid, will also differentiate your Mayer's hematoxylin. Then you're going to water wash, remove that acetic environment, stop that differentiation from happening. Blot dry again. So in the hood, lean it up, let it dry. Then you're going to mount it with what's called fluorescent mounting media. Don't let this confuse you. The media itself does not fluoresce, okay? Fluorescent mounting media just means that it's media that will not interfere with a fluorescent stain. So it's specific for fluorescent stains, okay? It's not that the media fluoresces itself, okay? So, you may see some yellowish, non-specific staining, but mostly you're going to see this apple green. And this is what it looks like when it's fluoresced. Yeah. And then we have one more stain to go. So Unfortunately, I have more people coming in to Zoom at the moment. So I'm going to stop here. Yeah. And we will pick this up, yeah, in um, the second recording I'm going to make for you. Okay. Okay. See you next time.